Good morning, Brian Walker here. I will be speaking this morning with Terry Burden, who's the Public Information Officer for the Lincoln Trail District Health Department. We asked our listeners of both Quixie 98.3 and 94.3 The Wolf to submit questions that they really wanted the answers to about COVID-19, the coronavirus, and the things that maybe they just felt like they hadn't heard yet or didn't know. We supplied those questions ahead of time to the health department, and Ms. Burden is here to answer those questions today. Again, there are 10 of those. We couldn't answer all of your questions, but again, we really appreciate the public's involvement in helping us get this selection together. So I want to welcome you. Thanks for coming in this morning and taking the time to be here with us.
Thank you. You're welcome. We're glad to be here. Any opportunity for us to get out good information, we like to do that.
Okay, so we'll go ahead and launch right in. Question number one, how is this different than any other respiratory illness that might be out there?
Well, a respiratory illness is defined as any type of disease that affects the lungs. And so coronavirus disease 2019, and I'll be calling it COVID-19 from here on out, is exactly that. It is definitely a respiratory disease. So actually, coronaviruses have been around for over 50 years. So you could go to your doctor even now, even before this happened, even before the COVID started, and get a test for a routine respiratory panel, and you would most likely test positive for coronavirus because it's just been around so long. What makes this different is that it is in the same family as the coronavirus, but it's a new strain. And that's why it was initially called the new or novel coronavirus, because it's a new strain within that family.
Okay, and how long do these symptoms last, or how long would you be contagious should you actually contract it?
Well, there's a lot of things that we don't know yet about this illness. There was a study that was recently done in Germany. So people are already starting to do research to find out more information. And that study was only done with about 9 people, but what they found out was that people are mainly contagious a lot of times before they have symptoms, okay? And in the first week of the disease is when they may be the most contagious. How long the symptoms last really depend on how sick the person is. And so that will definitely vary from person to person. Please keep in mind, new information about COVID-19 is developing all the time. So as we know more, this information may change.
Okay. Once exposed to COVID-19, can you ever catch it again, or is it like the chicken pox?
Well, it's I hate to keep saying this. I mean, this is the second time I'm going to have to say this, but we don't know yet how the body's immune system is going to respond to this disease. And so at this point, I can't tell you if once you're exposed, you will have antibodies that will last throughout the rest of your life, or it will be something similar to the flu, where every year you have to get a flu shot, and then you have to be prepared for that. So at this time, we just don't know more.
Now, if you receive the flu vaccine this year, are you more or less likely to get COVID-19?
What I want people to understand is that the flu vaccine helps protect you against the flu. The viruses, COVID-19 and the flu, are similar, but they are not the same thing. Getting the flu shot is always good. Public health is always going to promote people going out and getting their flu shot. Even right now, we'll say, go get your flu shot. Because it can help prevent you from getting that disease, and it is a very good preventative measure. There is not a vaccine for COVID-19 right now, although we're getting closer. They're doing tests in Kaiser Permanente in Seattle right now. They're doing their first clinical trial on the vaccine, but there's still many more steps that have to take place before we will actually have a vaccine in hand.
Now, why don't we just simply test everybody who has symptoms?
Well, everybody who has symptoms don't need to be tested. And let me kind of clarify that a little bit. A lot of the symptoms of COVID-19 are very similar to the common cold. So you may have a cough, a fever, you may have a runny nose, But that doesn't mean that you should go to your provider to get tested. So one of the things that we're putting out is that if you have symptoms like this, and I know we're in scary times right now, I realize that, but we want you to not seek care if you would not normally have sought care if COVID-19 was not on the scene, okay? But let me also say, we are only testing those who are at high risk. We are building capacity so that we can get to the point where we could test more people. We're not there yet. More and more commercial labs are coming online every day. And when we reach that capacity, then we'll be able to do that. In the meantime, those kits and supplies that we have must be reserved for those people who are at higher risk and who are most ill.
Where should someone be tested locally in the Lincoln Trail District Health Department's area?
Well, I definitely want the public to know this. We have posted something on our Facebook page that says, please do not come to Lincoln Trail District Health Department if you need testing, because the health department does no testing of the COVID-19. We are not involved in that process at all. You have to go to your local health provider if you feel that you are ill, or it's kind of like you need medical care, or you seek an emergency, or you really feel that you need to go and get tested for COVID-19. That is between the patient and the healthcare provider. They determine the criteria on who's to be tested, not us.
Okay. What if someone in your family tests positive? How can you quarantine if you just don't have anywhere else to go and you're in a household together?
Well, we are asking people, if you don't have anywhere to go, of course, if you do, it is best if you separate from that person, especially if they're pretty healthy and they can take care of themselves. But if you have to quarantine at home and stay in place, it is important that you move to another room. I'm sure everyone has heard about the social distancing that the governor speaks about, and I'm kind of push this a little bit here too. We know, before I answer the rest of the question, I'm sorry, but I can't miss this opportunity. We know that social distancing enacted or put into place now or weeks before can help reduce or prevent the transmission of COVID-19 dramatically. So the public really should take the governor's guidance to heart. He's already closed down a lot of businesses, he's asked that church services cease, and all of this is for very important reasons. There's a lot of science and history that proves that social distancing can have a huge impact on preventing the progression of the disease in the community. Now, having said that, sorry, I got on my sidebar there. If you are quarantining at home, you need to separate from the person as much as possible. Use a separate bathroom if available. You need to stay at least 6 feet or more from the individual who has tested possible. You need to restrict visitors who do not have an essential need to be in your home. Keep people over 60 years of age and older, those who have the compromised immune systems or chronic health conditions, away from that person. We are also recommending, there we go, avoid sharing household items such as dishes, drinking glasses, cups, utensils, towels, bedding, or other items with the person who has a confirmed case. After the person uses those items, you should wash them thoroughly using what you would normally use. The CDC has not recommended anything special at this point as far as household cleaners, but they do have on their website, if you're looking, you know what? They do have on their website a little section that says EPA approved disinfectants. But please don't run out and get that. Please know that what you have in your home will work just fine. If you have to wash laundry, please keep in mind that this COVID-19 is spread through respiratory droplets. So those droplets, when a person who has COVID-19 coughs on you or sneezes on materials, that type of stuff, that's what we're talking about here with the laundry. So immediately remove and wash clothes or bedding that have blood. But see, people who have the blood piece, they will probably be in the hospital if they're that ill. But, any COVID-19 case that's allowed to stay home, then just keep in mind that those secretions, the coughing or if they're sneezing, could be on their bedding, and you just need to wash them thoroughly.
Okay. If I can't work from home but I want to maintain safety, how can I do that? What precautions can I take?
The most powerful tool that we have is social distancing. I cannot stress that enough. So 6 feet from the person next to you, 6 feet or more. 6 feet or more, not less. 6 feet or more. I can't stress it enough. This means that you 6 feet or more. I'm going to say it one more time. From the person next to you. You could also just continue to practice those simple but effective things that we've been telling people all along. So avoid close contact with people who are sick and have a fever, coughing, sneezing. If you are sick, then you need to stay home yourself. Clean and disinfect frequently touched objects and surfaces with whatever your workplace is using there. Wash your hands often, at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. If soap is not available, then you need to use a alcohol hand sanitizer that has at least 70% alcohol in that. Avoid shaking hands. Avoid doing any type of physical greeting that will decrease that 6 feet distancing that we're recommending right now. So you can wave, do an air high five, smile at a person, throw the peace sign. You can do all those things, but maintain your distance.
And this will be our last question. Should I be concerned about takeout food being prepared by somebody who might not even know it and be infected?
Well, I think this is a good place for me to say how we defined what a close contact is, okay? So I've already kind of spoken about that it's passed through respiratory droplets. But what I also need to stress is that our kind of definition, the definition that we are using as a close contact is, one, you must be within 6 feet of that person, so less than 6 feet from that person. 2, you have to be in their presence less than 6 feet for at least 2 hours or more. That is what we consider a close contact. People are concerned. We've had phone calls about, and this is not to be humorous, but this is hopefully will help answer some of the questions some of the numerous phone calls that we have regarding this question. We have a lot of people call. I know a person, I know a friend who knew a neighbor whose friend went to a wedding, and that friend's father may have or was tested for COVID-19. That does not make you a close contact. Your risk of COVID-19 at that is very low, of getting COVID-19 is very low. So please be reassured that the likelihood of you having COVID-19 with the definition or the scenario I just described is very low. A lot of times, the people who call with that scenario, the person does have no symptoms at all. That's the other caveat that I want to stress. And so, as I mentioned before, the definition for a close contact is someone who is less than 6 feet, who has been in prolonged contact for 2 or more hours. So being in the same room with the person for a few minutes or just walking by them in a hallway really makes you at low risk for contracting COVID-19.
Okay. Did you have anything else you wanted to address while you were here that wraps up our 10 questions?
Well, I think what I want to stress more and more is that continue to seek our webpage, ltdhd.org. We try to keep it as up to date as possible with the latest information. You can also visit the state website at kycovid.org. No, that's not right. .gov, sorry. kycovid.ky.gov.
Okay.
Yes.
Well, and I guess wash your hands and stay away from folks.
Yes. Doing those simple steps with social distancing will make a difference.
All right. My name is Brian Walker. I've been speaking with Terry Burden, the Public Information Officer from the Lincoln Trail District Health Department, and answering the 10 questions that we felt like most of our listeners really wanted answers to. Those questions, again, supplied by our very listeners. Thank you for joining us.